once you see it all come down, feel free to share. I'm a harm reductionist, social worker, and community organizer living in the Philadelphia area, working within street medicine and global health advocacy. I'm also the media and education lead for the LUNAS Global Health Network US, a pending 501c3 nonprofit that's part of a much larger network that we'll talk about soon. So once again, welcome to Sustaining Solidarity through the Global Struggle for Health. We're excited to be here and share some of our work, and thank you to the PAPHC planning team for inviting us. So yeah, why don't we go ahead and get started? Next slide, please. So this is our agenda for the workshop today. It's going to be partly a space to engage. There'll be some time to answer questions and to talk in the chat, or hopefully in breakout rooms if we get there in time. Then we'll go ahead also and do a good bit of an educational piece. We'll talk first about who the LUNAS Global Health Network is, what we do, our mission, vision, and goals. We'll start with a grounding question to situate ourselves before moving on to the educational piece, crisis and response, an educational section looking at case studies of crisis and response in the Philippines to better inform LUNAS's role in the public health action in the role of acting and responding in public health in the Philippines, and kind of our role as members of the diaspora and as individuals engaging with public health on the ground. And then, given the time, we'll start at the bottom. Next slide, please. So LUNAS. LUNAS is a word that in Bisaya, which I'm sure a lot of us know is one of the major spoken languages in the Philippines, refers to a certain plant or mixture of plants and herbs that treat various ailments. It means to remedy or to cure. In that vein, the LUNAS Global Health Network is an international network of organizations, institutions, and individuals striving to strengthen and sustain grassroots health programs in Mindanao, or the southernmost region of the Philippine archipelago. After an undeniable need for healthcare support in the southern Philippines was highlighted by the recent pandemic, the LUNAS network was formed and remains guided by communities and grassroots organizations on the ground in the Philippines. We believe that healthcare is a human right, solidarity across borders leads to lasting change, and education and collaboration lead to transformative action. These are our roots to help us grow. Next slide, please. So in the context of the ongoing health crisis and climate disasters in the Philippines, LUNAS works to meet urgent needs of Mindanao's indigenous, peasant, and plantation worker communities through international education and advocacy and direct partnership with initiatives, projects, institutions, and grassroots orgs working to overcome barriers in health access. We understand that healthcare is a basic human right, and health inequity is a reflection of the social, economic, political, and cultural structures and histories of our society. Again, with this understanding, our network serves to be guided by those most affected by public health crises in the Philippines. So with that brief understanding, we'll now move on to some grounding question here. As I'm sure we all know, the focus of this year's conference is the new public health, asking us to look at communities that are most affected and think of new ways to problem solve and improve their health. I know the panel that we just got off kind of addressed this as well, but I want to ground ourselves first in this question. Feel free to throw some thoughts in the chat and I can read them out. But what does the new public health evoke for you? What ideas, lessons, practices are you carrying as we collectively begin to move towards defining this vast change? So we can take a minute, feel free to throw some thoughts in the chat, and then we'll move ahead. I know that there were a lot of good comments made during the end of the panel there about using our own imagination as a space to move towards public health. I think spoke a lot towards me. Community over the individual, exactly. Not putting a price tag on health is huge. Other thoughts? It makes me think of how all our health is interconnected as seen by the pandemic. Certainly the pandemic has given a global view towards health, understanding that we're all in the same struggle now. Yes, exactly. Healing accessible to everyone, really emphasizing the intersectionality of public health. Yeah, these are all great responses, bringing justice to marginalized communities so that there won't be a need for equity and equality. Right, so feel free to keep throwing them in there. These are all fantastic. It helps us understand how vast this shift needs to be. So there's many things that the new public health encompasses, but we're going to be focusing just on one aspect of that during this workshop. And that's going to be grassroots internationalism. What does that mean, you might be thinking, because those are buzzwords. So we'll break them down. We can look at internationalism and understand it as a commitment towards international cooperation, towards mutual benefit, towards this recognition that people from different nations work together to lift up each other. And grassroots can be defined in many ways, often used in lots of different contexts, but we're going to define it today as guided by the source or rooted in the foundations. Grassroots as an action or a movement recognizes that the people themselves are the mechanisms of change, not politicians, organizations, or the government. And grassroots work is work that seeks to unite this, or to use this understanding to bring people together and support lasting change. So together, grassroots internationalism is recognizing that there are the resources to support local struggles, and that we can help mobilize these resources toward communities that ask for it to sustain local work, prioritizing local agency and promoting local struggle. Next slide, please. Or to reiterate in the context of the Philippines, in the absence of sufficient governmental support, it is imperative that we uplift, strengthen, and sustain grassroots struggles in the Philippines. So this will be the focus of the rest of this workshop and ultimately the goal of the LUNAS Global Health Network, understanding the context of these ideas of grassroots internationalism and how to support it through a lens of public health in the Philippines. So now we'll move on to the main section, crisis and response. We're going to look at two different kind of case studies of public health crises in the Philippines, COVID-19 and Typhoon Odette. Taking a look at the impact they've had and the governmental response versus the grassroots response, all to kind of highlight LUNAS's work supporting local struggle through this lens of grassroots internationalism. And once again, our role as members of the diaspora interacting with public health on the ground in the Philippines. So first up, we'll talk about COVID-19. And I'm sure, as a lot of us are aware, COVID has hit the Philippines pretty hard with what is now the second worst rate of COVID in the Western Pacific. Been over 3 million confirmed cases and 50,000 deaths. All of this, of course, being massively underreported due to barriers toward testing or fear of testing and testing positive under governmental repercussion. Moreover, COVID is taking its toll on an already weak healthcare infrastructure. It's a healthcare infrastructure that is not properly publicly funded, that lacks healthcare workers, although healthcare workers are one of the Philippines' highest exports. There are delays at every phase of testing and vaccination, and it all creates this self-exacerbating cycle, increasing the burden on a system that is unable to respond to crisis. It's a familiar issue for a lot of us in the US, something that we can all empathize with and understand as we have kind of faced these same issues during the pandemic here. Furthermore, COVID has amplified inequality and social divides. Those most affected by COVID are often the poor and dispossessed, put at further risk for starvation, shelter insecurity, and state violence. We see here that the health crisis then extends from the pandemic itself to create broader issues of simple survival. Next slide, please. So how can we make sense of these devastating impacts? Well, we can take a look at three of the pillars that have defined the governmental response to COVID in the Philippines: privatization, militarization, and misinformation. We'll first take a look at privatization. So simply put, privatization is the shift from public to private ownership. It's been a long-standing policy in the Philippines and something that we've adopted from the US. Something, again, an issue that we see rampant in the US healthcare system. And what this looks like in healthcare is that the state, or the Philippine state, puts companies and their profits first before the Philippine people and their right to health. What's more, by increasingly making healthcare private, the government puts a price tag on public health and individualizes responsibility for a global disaster. And this has manifested in several critical ways. One is the individualization of responsibility, putting this focus on behavioral changes rather than addressing structural issues. For example, blaming people for breaking quarantine because they have to work to find food instead of addressing a need for food assistance. Also, commodifying PPE and essential services has been a big issue. People often paying out of pocket for PCR tests in the Philippines that costs up to 10 days of minimum wage work. And lastly, of course, has affected the budget. In 2020, 15% of the Department of Health's COVID budget, or about $11 billion, went unspent. And in 2021, that budget was reduced by 18%. And as of August of 2021, 62% has gone unspent despite a growing need for it. We see here how healthcare based not around need, but one that prioritizes those who can pay for what they need only makes communities suffer more during such a crisis. Next slide, please. While privatization policies keep the Philippines ill-equipped to care for the health of its people, there's no shortage of funding or political motivation for policing and militarization. So rather than public health, state violence is the primary tool used by the Philippine government to address the pandemic. We see this largely in the military-led COVID response team, which is led by mostly military officials rather than anyone who has a public health background or understanding. It's no surprise to see the policies that they have put into place, such as what the UN called the police state lockdown, using often the pandemic as an excuse to crack down on dissent in the Philippines. In the first year of COVID alone, over 300,000 people were apprehended with detentions and fines for breaking quarantine restrictions. Of course, again, those breaking it are the ones made most vulnerable by the pandemic. And what's more is that these policies didn't do anything to restrict the spread of COVID within the nation, highlighting the failure that violence brings when we need public health. And lastly, we'll talk about misinformation. So without a response led from a public health standpoint, many rural communities are left with little access to credible information. There have been a lot of spreadings of DIY cures like drinking boiled ginger or vitamin D, and figureheads like Christian cult leaders or even Duterte spreading misinformation about the vaccine and PPE. There's even this quote, Duterte speaking on national media saying in response to lack of PPE in the nation, just go to the gas station and then have some drops. That's disinfectant, I'm not joking. It's true, you think I'm kidding. So of course, this breeds confusion when leaders speak like this about a crisis that is killing millions. While the Department of Health and other public figures have come forth to debunk these myths, there's a lot of latent mistrust toward these figures, largely due to decades of corruption scandals and a recent issue with a dengue virus that was pushed a few years back that ended up making folks more susceptible to the disease rather than less. And it's important to note that in rural areas, like those that LUNAS serves, this lack of access to newspapers and televisions is much more rampant. More so, any credible information on COVID is often only printed in English and comprehensible to middle and upper classes. So now we understand a little bit about the government response. We can take a look at how LUNAS, as an example of grassroots mobilization, has responded. And it's done so mainly in 3 areas, with medical clinics, information drives, and through coalition building. So LUNAS has set up and is working on sustaining local clinics in Mindanao. We've had an on-site clinic in Bukidnon and a mobile medical clinic visit communities directly, mostly plantation workers across Mindanao. Our patient population includes indigenous communities, middle-class professionals, students, informal workers, urban poor, and plantation workers. We offer a range of services from primary care to basic medications, pediatrics, and lab testings, all necessary preventative measures that are often out of reach for these communities. In addition to COVID-related responses here, we seek to treat specific rural and plantation worker morbidities, such as medication for parasites, asthma, or other respiratory illnesses done through exposure to environmental issues, destruction, pesticides, and industrialization. Education is also a key point of the LUNAS Global Health Network. We hope to, we have been instilling these projects of information drives to share accessible information, both about COVID-19, PPE, vaccines, and healthcare in general, in native and colloquial languages. Doing these directly in communities or alongside medical clinics. Also using radio media to disseminate knowledge and let people know beforehand about this information or about the clinics coming towards their areas. Ultimately, the objective of LUNAS and of these information drives is to serve the poorest of the poor in a manner that is deeply conscious of and in direct response to the people's immediate and long-term physical and emotional well-being. Education is a key part of LUNAS. We hope to use language as a tool towards getting better health. And lastly, we'll speak about coalition building. So all of these actions were only possible due to initiatives voiced and begun by affected communities in Mindanao. They have led with recognition that support is needed and took action to build partnerships, alliances, and alliances and coalitions with each other and with national and international entities to support these projects. These partnerships are necessary in order to sustain long-term mobilization of their work. And this is where we return to the idea of grassroots internationalism. Rooted in these calls to action by communities on the ground, networks can support to give them the resources that they require and sustain their work. Or to sum it all up here, through COVID, we know that the government does not care for its people, let alone those who are made most vulnerable, often responding with violence or neglect. But communities seek to sustain their own care through partnerships with networks like LUNAS. And we can use them to address public health issues in a new way. So after understanding this, we'll move on and talk about Typhoon Odette. But before we do that, a brief aside, put your answers in a chat. Why is climate change a public health issue? We talk about environmental disaster, we talk about, pollution, but how do these things affect people's health, and why are we as public health professionals and aspiring young professionals want to keep this in mind as we go into our work? So yeah, feel free to throw some stuff in the chat. We'll take a minute. Again, I'll read some things out and then we'll move on. Health of the land is tied to health of the people. Exactly. Yeah, we understand that climate change affects not just the land itself, but the environmental and social detriments of health. National disasters often affect the underprivileged. Yes, always affecting the poor and dispossessed before anyone else. Thinking about the examples of wildfires in California, right? I'm sure we can all empathize with the way that the climate is affecting those in the US. Land is life, land is life. Thank you. Yeah, these are all fantastic responses. So we understand here clearly that climate change exacerbates existing health conditions and creates new public health challenges for us to face, not just immediate ones like wildfires, like typhoons, but longstanding ones that continue to affect the people who are most vulnerable. Of course, we can go on and talk a lot about this, but we don't have that much time today. So we'll scoot ahead and start talking about Typhoon Odette. So as a lot of us know, Typhoon Odette hit the Philippines on December 16th of 2021. It was an out-of-season super typhoon that left swaths of destruction across provinces in Visayas and Mindanao. It impacted 7.4 million people, injured 1,200 with 78 missing, 375,000 displaced, and 402 left dead. In addition, there are over 500,000 houses and buildings damaged, with over 170,000 houses completely destroyed, and $16 billion in damages to local infrastructure, including roads, electricity, and plumbing. Currently, a total of 334 cities and municipalities are now under a state of calamity as of last week. This has also perpetuated a continual impact on local health. Damage to infrastructures has caused exacerbation to already devastated communities. In Surigao, where Typhoon Odette first made landfall, 9 people have already died of dehydration caused by diarrhea due to the lack of clean water. With almost 900 cases reported of this in the region since Typhoon Odette, those who are being most affected are those who have been left homeless by the typhoon itself. Water supply remains irregular and food needs have not been addressed. We see once again how intimately tied climate change and health are. So let's go ahead with the second case study and think about the governmental and grassroots response to this clear public health struggle. So in 3 words, The governmental response to Typhoon Odette has been sluggish and inadequate. You might be thinking, there's not a lot on this block, and yeah, you'd be right. While the Coast Guard aided in immediate rescue support in some areas, national government support has been scarce to none. On December 22 of 2021, Duterte announced that he would be directing 199 million US for typhoon relief directly to affected communities. Yet his budget department would not commit to expending the funds to provide immediate assistance to these affected areas. And to this day, a lot of these funds are still missing. So how did he make sense of this? Well, the regime essentially deflected blame, using excuses such as depleted governmental funds, media under-reporting, and impassable roads. Yet we know that all of these aren't exactly the case. As we've seen from the unspent COVID budgets, the government tends to have money that can allocate to other areas. And in terms of the media, the government itself controls the most extensive regional media network with the best equipment and best resources to go in and respond to report. Yet we've only seen mostly small and independent journals being the ones to report and share the stories on the ground immediately after Odette has hit. The Philippines is a country that has a history of being ravaged by typhoons, and it should have the budget to mitigate and provide for immediate relief, even when responding to the pandemic. Again, as in practically all massive disasters in the Philippines, the response of the civilians or the private sector becomes the crucial factor, much more than the governments. So next slide, please. So with that understanding, we can move towards the grassroots response. We understand that, again, the private sector and grassroots orgs have led the response towards relief efforts from Typhoon Odette. Many grassroots orgs were able to mobilize immediately, day of or right after, by using the networks that they have built to spread information, garner support, and respond with action. A lot of groups have been able to do fundraising drives or work with folks to find appeals for funding from other entities, send out rapid assessment teams working to understand damages and need that still exists in affected communities, doing direct food assistance or shelter rehabilitation, and providing relief packages to those on the ground. Folks in our own network have been working on the ground to collect stories and deliver packages in Surigao City. Of course, all of this has been possible due to locally organized networks and help from sources of individual donors, partners, and international entities. In this dichotomy, we see the power of networks to assess and act, to get what is needed and to respond efficiently. We see the sad reality that those who are caring for people are the people, not the government. Once again, highlighting the impact of a network like LUNAS to sustain solidarity and action among those who have been failed by the structures that are meant to support them. So with those two case studies under our belts, we can kind of reorient and understand what this means for us as a network, as LUNAS, and us as individuals trying to support public health on the ground. How can we take these lessons, these understandings toward this idea of the new public health? And we can do so in 4 ways: grounding in local struggle, prioritizing self-determination, building committed networks, and sustaining mobilization. So for LUNAS, in order to address public health issues on the ground, we truly ground ourselves in the struggles of local populations by being in partnership with communities. Again, we remain guided by those on the ground, those most affected, and those immediately responding. This also helps and is a key point towards prioritizing self-determination for these places, these areas, and these partnerships. Again, LUNAS was founded and remains guided by these people. And when we think about the new public health, in order to begin finding new ways to support and serve communities most affected, these communities need not to just be a part of the conversation, but to lead these conversations. In doing so, we can help to build committed networks. Through these connections rooted in the foundations of these issues, LUNAS seeks to build committed networks of individuals and orgs able to sustain the work on the ground. These networks are places not just to continue a struggle, but to share practices, learn from one another, and recognize that the struggle for health is a global one and one that we all need to be present for if we want to win it. Lastly, sustaining mobilization. It is important to mobilize in times of crisis, but necessary that these actions remain present. For them to be long-standing agents of change, not one-offs, but eternal. And in the context of the Philippine struggle for health, we need to prioritize this idea of grassroots internationalism and recognize that networks like LUNAS are crucial agents carrying out the ethos of the new public health. Again, we return to this understanding that in the absence of sufficient government support, it's imperative to lift up, strengthen, and sustain grassroots struggles in the Philippines. And that we know that it is the people who leads and the people who must stand together across the globe. So with that understanding, we can move forward to a debrief and discussion. I know we have a good bit of time left. So why don't we go to the next slide and we can think about these questions. We can jump hopefully into breakout rooms of 3 or 4 people. Spend 15 minutes kind of talking about these. I'll throw them into the chat. And we can come back as a big group, share some takeaways, and then we'll do a little closing here. So these questions are going to be, while we set up some breakout rooms, what are you taking away from this workshop, and what lessons can you translate to your own work in public health? How can we, as part of the diaspora, extend our support to the struggle for health on the ground in the Philippines? And what examples of international solidarity have you been experiencing in your work, in your life? And what can be learned from our experiences? I think especially that one was kind of addressed through this last panel as we think about guiding our work from ourselves and being rooted in this as communities. So Camille, I think whenever you're ready, room 1 and 2 going in.
They really are.
Yeah, I hope everyone has been able to have some good discussion on the topics we've been presenting about today. Yeah, take some time and think about some of these lessons that you've learned from one another as we've come into community here in this strange digital space. Hey y'all, welcome back. Hope everyone had some good discussions. We have about 5 minutes or so to kind of talk as a group here. Feel free to speak up. You know, what's sticking with you from these, not just from the presentation here today, but especially from these moments that we spent in these breakout rooms, this time to kind of sit in digital community and think about ideas of grassroots internationalism and this new public health. So who wants to speak up? Anything to share? What was your group talking about? We can just sit here in silence for 5 minutes too.
I guess I can start. So my group was essentially talking about, you know, as cruel as it seems, it's really, you know, we can't really rely on the government to go ahead and save us when we're already doing the best we can ourselves, whether it be like donating funds towards the towards those who need it in the Philippines, or supporting ourselves with COVID and everything, giving resources to those who need it most. You know, we're our own powerhouse, and you know, if the government isn't going to help us, then, you know, screw them. We can do it ourselves, and no one's telling us otherwise.
Yeah, definitely so. Kind of drawing to these ideas that Bernie was saying in the panel of leading with your imagination towards the new public health. You know, there's always different contexts about, right, what it means to rely on a state or a government. Like in the US, we have so many resources that should be allocated towards the people. But when you think about the Philippines, it's a country that has been, you know, ravaged, its resources taken, its people's taken. And so, yeah, these connections are so necessary, and it falls on the people to do this work. Thanks for sharing. I appreciate the insight. Other thoughts from folks? Group 1 and 2, y'all were in there the longest. What were y'all talking about?
For the second question, how can we as part of the diaspora extend our support to the struggle for health on the ground in the Philippines. Jen basically talked about amplifying those voices in the Philippines that are doing that advocacy work and making sure that they get the help that they need on our side, because they know the most about what's going on and they're the most informed, and it's really important that we center those voices.
Yeah, definitely so. Camille and I were talking during the breakout room time about how a lot of us, as part of the diaspora, are here in the United States on the backs of ancestors who were healthcare workers or who are healthcare workers, and feeling this legacy of sorts that needs to be carried on. But there are ways to work within, carrying on that torch while still supporting and advocating for communities that are still on the ground there and for communities that are here in the Philippines. So yeah, uplifting them, education, advocacy, certainly a huge route that a lot of us can take as we continue towards, our own professional paths here. And yeah, good question in the chat. How can we center those voices without putting them at risk from the current government? I think that a lot of us know that the Philippine government itself, right, as I said, uses a lot of state violence, a lot of tactics to kind of put down communities who are trying to fend for themselves. And there are a lot of different, I think, ways that we can talk about how to care for these people and support them without putting them at risk. And that's one of the things that LUNA seeks to do. As a group that is rooted in those communities and guided by them, we still use connections to, what you could call as more official sources, like Greenpeace, for example, to give authority and emphasis on legitimacy, to create these structures and networks that hold power within, the reputation of their members, in order to not be tagged, in order to not be struck down or targeted and brought on. But that's a question that, I think is a great thing for us all to think about as we move towards advocacy. How do we advocate for those who are most in need without harming them? Something that I think we can all take away and think about today. So time for one more thought, one more question before we close up. Camille said, don't be shy in the chat.
That makes sense. When it comes to international solidarity, I think we were thinking about like how much power we have when it comes to like our currency and our money, and when it comes to foreign exchange. So like $1 for us is kind of negligible, but for someone in the Philippines, it's like, that's a meal, or that's a meal for their entire family. So like, if we can think about the very privileged convenience of having like a $3 coffee just to get us through the day, when someone's like scrounging for that, it's like, what's $3 to us when it's like a whole day where they don't have to think about the next 3 meals, So it's just the small things like that to think about, and actually like actualize that thought, and like actually donating the money is one of those things. Yeah, no, definitely so. And right, I think in the same vein, how do we do this in a way that we understand that these resources are going to the people who need it most, doing our research and understanding the networks that we are kind of impacting and the people that we are supporting and the groups that are working towards that end. But material support is huge, and something that, seems kind of small at times, but can really make a big difference. So let's close up now. And last slide, please. I'm going to throw in the chat a quick Google form link. If any of you feel like you want to be involved with the LUNAS Global Health Network, either to be a part of it, to be on our newsletter, or to have us come in, do some workshops, educationals towards your own schools, organizations, institutions, feel free to fill that out. We'll also be on the network spreadsheet that'll be going out. I want to say thank you again to the PAPHC planning team for having us, to my other workshop collaborators, Christina, Meredith, and Joseph, our student volunteers for their research, Jackson, Riza, Andres, and Benny. And feel free to follow us, please, on Instagram, Facebook, or check out our website. Thank you again for having us, and looking forward to finishing the rest of this conference here with y'all.
So I think we just hit time. Thank you again, and enjoy the rest of the conference.
Thank you.